Everyone, I'm Dr. Tushar Mehta. I'm an orthopedic surgeon and a faculty of orthopedics for PG aspirants and for the postgraduate residents of orthopedics. This small video is about a clinical entity that honestly we don't see that much often in our day-to-day clinical practice, but probably it will help you to solve an MCQ. So let's talk about that. I'm giving you a kind of a clinical situation. Casualty almost 1:15 a.m. in the morning. A lady walks in and she's all messed up and hassled, and she walks in. There's a preschool child, there's a 2.5-year-old child. He's in terrible pain. The mother explains that yes, he has a lot of pain in multiple areas, along with that probably certain swellings. And even she gives you a hint that probably her son has had multiple fractures, and she keeps on crying and sobbing. And then the child is taken into the emergency room, and still the lady is crying quite out of proportion. And probably that gives a hint to the attending doctors that there is something beyond this. And they examine the child. They examine particularly the buttocks, the axilla, behind the ear, the scrotal area, the flanks, and they see a lot of bruises and abrasions, and that gives them a clear hint that it is a non-accidental injury, NAI. It is a child abuse. It is most likely, I'm sure most of you guessed it right, battered baby syndrome, also what is called as Keffi's syndrome. So let's talk about it. The first thing and the foremost thing which can come as an MCQ is that there is an X-ray hallmark of battered baby syndrome. That is something which is called as CML. What is a CML? It's a corner metaphyseal lesion. Try to understand. The moment we clinically suspect that this patient is probably a case of battered baby syndrome, the first thing and the foremost thing we have to do is to get an X-ray of both the wrist. Why? Because we will be able to see the corner fractures, the bucket handle fractures, which are basically the small chips or the small avulsions from the metaphyseal ends of distal radius anal. As you can see on your screens right now, on the right hand side, these black arrows are showing you small chips from the distal end of radius anal, particularly from the metaphyseal fragment. These are called as corner fractures. And if you see towards the left, so probably you can say that yes, this is a bucket and this is probably got a handle like that. So these are called as bucket handle fractures or corner fractures. But the bigger question is why. I'll tell you why. See, you have to understand, when somebody is going to batter a baby, that somebody is not going to say, "Beta, stand at your place, I'm going to batter you." No, he's going to hold the wrist of the hand of that child. He's going to, with one hand, the person is going to hold the hand of the child. He's going to apply a twisting force to his extremity, and then from the other hand, he's going to start the bashing part. So because of these forceful twisted movements to the extremities which are applied, you will be able to see small chips, as I have already shown you, small avulsions, which I have already shown you, one of the classical X-ray hallmark of battered baby syndrome. But that doesn't mean that you'll be able to see only these fractures. There are other areas of skeletal injury, particularly the ribs, the skull, the extremities, of course, the tibia, of course, the distal end, of course, and probably a spiral fracture. Again, I would like to reinforce the fact into your head that majority of the skeletal injuries are seen in lower extremities, followed by skull, followed by rib cage. Now, this is the very important part, that the moment you see a child, a preschool child with multiple fractures, long bone fractures, history is concealed, mother or whoever has brought the child is crying out of proportion, and they give you a misleading history, they give you a confusing history, things are not matching up to the trauma, and then you have to observe the signs of violence. And please do not leave any awkward site, particularly the buttocks, the perineal, the natal cleft, behind the ears, behind the neck, axilla, flanks, everything. You might see, because I have seen, so you might see abrasions, bruises, lacerations, grazes, bite marks, belt marks, incised wounds, cigarette butt marks, burns, anything and everything. So all these things are cumulatively taking your attention towards the probable diagnosis of battered baby syndrome or an NAI, non-accidental injury, rather than the typical other causes of multiple long bone pathological fractures in a child. So guys, that was it. A small video snippet about a commonly asked question, and I hope you liked the video. And do subscribe to the YouTube channel, and please look at the list of options of the other videos. I hope you will find them informative as well. So thank you so much. Stay tuned for more videos like this. Bye bye.